going to talk about your surgical incision for just a moment. You will have a simple gauze dressing over that while you're here in the hospital. We will change that as many times as we need to while you're here, and we will send you home with several dressings to do dressing changes at home once you are discharged. A couple of tips at home. Obviously, it's going to be difficult to change your own back dressing, so someone's going to be helping you with that. Please be sure that they wash their hands very well before removing the old dressing and placing the new one. I do want to point out it is not unusual for incision to bleed or drain slightly for about 2 to 5 days after surgery. After your initial dressing change here in the hospital, it'll be changed as needed to keep it nice, clean, and dry. And depending upon your type of incision, we will give you more and specific instructions on your discharge from the hospital. Most often, the surgeons will use staples to close your incision. Every now and then they will use sutures. Either way, you will have an appointment about 2 weeks after your surgery to go back to the office to have the staples or sutures removed, and your incision will be checked at that point in time. You can shower when you go home. We will give you detailed instructions on that when you are discharged from the hospital. But a few tips: don't scrub directly on the incision. Certainly don't pick away any scabbing from the incision. And if there is any unusual drainage that looks like it might be infected, certainly call your surgeon's office right away. Infection prevention is very important. As I noted earlier in this video, we do use the scrub packets the night before and the morning of surgery. Also, an antibiotic is often given to you during your surgery. Sometimes, especially if you do have a surgical drain, we will continue those antibiotics periodically through an IV while you're here in the hospital. This is something we really want you to pay attention to once you go home. Any unusual swelling, redness, or drainage from your incision, any change in the color or odor of the drainage you may be having, and a fever of 101 degrees that lasts for more than 24 hours. Very often, people after surgery will have little low-grade fevers. That's normal. If you drink plenty of water and use your incentive spirometer, that actually will help decrease your fever. If those things don't work and your fever does persist, please call your surgeon's office to let them know immediately. Again, with infection prevention, like I mentioned, anybody who's going to help change your dressing, do anything back there, make sure they use very good hand washing technique. Other complications we like to prevent. We talked about using the incentive spirometer to prevent respiratory complications. We also want to prevent blood clots. I did mention the SCUDs, or the sequential compression devices. Those are very instrumental in helping prevent blood clots. Anytime someone goes under anesthesia and they go through surgery, risk for developing blood clots just simply goes up. We know this, and so we try to do all the simple things we can to help prevent that from happening. Another thing you can do very simply is to paddle your feet back and forth, flex them. That also activates your calf muscle, which in turn squeezes blood vessels, which in turn gets blood up towards your heart. So just paddling your feet back and forth is also very helpful. Walking, that's the number one thing that you can do for yourself to help prevent blood clots. And if your surgeon feels it's necessary, we may give you a mild blood thinner while you're in the hospital in the form of injectable heparin or Lovenox. We'll cross that bridge when we come to it, and that will not be something that you take home with you. But it is very important that we do all the things that we can to help prevent blood clots from happening. Most people want to know, how long am I going to be in the hospital if I have to stay? With a spinal fusion, average length of stay is 2 days. So let's say, for example, you have surgery on a Monday morning. You can expect to go home sometime after lunch on Wednesday. Every once in a while, we'll get somebody who's a real rock star who just does great right out of the gate, and they can go home the next day. That's not the usual, but it does happen. We also do have patients that are a little more debilitated because of all of their back problems that need a little bit more time. They may stay with us 3 or 4 days. And certainly if they need inpatient rehabilitation after surgery, that is something we can definitely set up for them. But discharge planning, as we always say, starts before your surgery ever happens. I did mention getting your home ready for discharge. Other things that you can do aside from clearing pathways and making sure things are safe is grocery shopping, making sure there's nutritious and plenty of food in the house for you to choose from once you get home. I talked about pets. When you get home, have a plan for maybe putting your pets just out of your way long enough for you to get seated so you don't have any fall or tripping hazards. We do like for you to have somebody around for the first several days after surgery. Many people have a spouse or children that live at home, and that's not a problem. If you do live alone, try to make a plan for somebody to be with you for a couple of days. It doesn't have to be the same person the whole time. It is okay if a person has to run out to the store and come back. That's fine. You don't have to have somebody with you 24/7 for that first week, but it is good if you're not completely alone. Also, something else we like to encourage, of course, most of us have cell phones these days. Keep your phone nearby. If you're somebody who doesn't have a cell phone, make sure you have a cordless phone, and you may keep that in the pocket of your sweater or something with you. So as you go throughout your house, if something were to happen, you would be able to call for help if you needed to. Good resources for these sorts of things, of course, are spouses, children, friends, church members, neighbors, and all that sort of thing. You probably have a lot more resources than you realize. So go ahead, plan ahead, and make sure that you have a safe return home. Other things that we can discharge plan with you are things like medical equipment. Most of our spinal fusion patients, we encourage going home with what's called a front rolling walker. We discourage the use of a standard walker because you actually have to pick that up with every step that you make, and we don't want that stress on your back. Four-wheeled walkers are a little bit dangerous because they can get away from you. So just the front rolling walker is what our surgeons recommend. If you feel like you need a bedside commode for home, we can also get something like that for you. A lot of people will take the insert out of it, place that over their toilet, and it's got 4 legs and 2 arms, and it helps you get up and down off the toilet a whole lot easier. Something else you can do with a bedside commode is put the lid down, and you can use it in your shower also as a shower chair so you don't get fatigued while you're bathing. All of those things we can get orders for and get delivered to the hospital before you leave us so you can take those home with you. Some of our spinal fusion patients do their exercises very well and manage things on their own, and we give them their discharge instructions and they're fine. Others, they might need a little bit of home health. So our discharge planner will discuss all your home needs with you, and she will make sure she gets things ordered and set up for you before you leave the hospital. As I mentioned before, some patients are very debilitated with their spinal problems and will need a little inpatient rehabilitation. Again, that's something we very easily can set up for you, and from the hospital we will get you safely to inpatient rehabilitation.